technology, assisted reproductive technologies. What is that?
So yeah, it's a couple of technologies that basically just helps infertile couples achieve pregnancy or help them conceive, pretty much. So normally they'll define infertility as unprotected sexual intercourse, at least over a period of 1 year. Some I think recently they moved it back to 6 months, without pregnancy. That if you get married to someone and both of you have unprotected sexual intercourse for at least 6 months and there is no pregnancy occurring, then there is something wrong. All right. So then they'll start investigating. Perhaps there is infertility ongoing. Then they'll test the guy, check his sperm count, his health, his hormones. They'll check the lady as well, check the hormonal profile, pregnancy hormones, check the anatomy of the uterus, fallopian tubes, the ovaries. They want to know, does she produce eggs? Are the fallopian tube blocked? Are there fibroids in the uterus preventing pregnancy from happening? Are the hormones messed up? The hormones control a plethora of reproductive events, right? It's one hormones that controls the ripening of eggs and the release of eggs. All right. So if you don't produce a certain hormone that is supposed to help you produce eggs, you will never get pregnant until they actually treat that. All right. So they can actually regulate the imbalance in the hormone production. Same goes for the guy. There are some guys that when we do a semen analysis in their sperm, right, we notice that some of them have a low sperm count. And there is a threshold that we consider healthy sperm production. You should have at least a minimum of 20 million sperm, with about 40% of them being motile, progressively motile, all right, and having a good morphology, normal shape. And people can have good sperm production, abnormal morphology. You see sperm with two heads, two tails, agglutination, clumping together. So those are issues that could prevent pregnancy from occurring. And even if pregnancy occurs, imagine a sperm with two eggs fertilizing an egg, it's going to create an abnormal embryo. And sometimes the body has a system in which it actually discards or spontaneously sheds progression and pregnancy for those kinds of implanted embryos. So there are investigations that we will do that would establish infertility. And once infertility has been established, then we'll now start to try looking into assisted conception alternatives or technologies that could still help those couples achieve pregnancy safely. So then we start looking into, well, maybe we should try artificial insemination if there is maybe an issue with sperm getting to the site where the eggs are. We can directly introduce the sperm into the entrance of the fallopian tube, for instance, and they can achieve a faster rate to pregnancy, right? Or if the fallopian tubes are blocked, we can do a surgery that would bypass the fallopian tube and harvest the eggs, and we take the eggs to the lab and fertilize them with the sperm in the lab, in the petri dishes, culture the embryos, and transfer them back to the uterus between 5 and 7 days of incubation culture. So there are different technologies that we can adopt or use or that are available based on the diagnosis, the infertility diagnosis. Right, if it is male factor infertility, they could recommend lifestyle change. If it's low sperm count, right, take some vitamins, do healthy living, exercise, supplements and things like that. Sometimes they help, sometimes they don't. Right, if it is issue of low sperm count, then we know that we have to use a specialized technology that will specifically take the limited amount of sperm and we directly inject them into the eggs. right? That's not a technology. But for those who don't even produce sperm at all, maybe it's obstructive azoospermia. Azoospermia is the technology we use for no sperm production. I mean, some people will think they produce sperm, they will produce an ejaculate. An ejaculate, I mean, it does the same thing as you having semen, I mean, sperm samples, right? So a semen sample is sperm cells and prostate fluid, like you studied prostate cancer, right? So
Yes.
the fluid produced by the prostate gland, right, and other accessory glands, that is the seminal fluid, and it has its own function. Sometimes it helps to protect the sperm during, I mean, when it gets into the canal, the female vaginal canal. The female vaginal canal is known to be acidic, right? That has an acidic pH. You can imagine if you just introduce sperm cells bare like that with no seminal fluid protecting them, they're going to die. The acidic environment will kill them. So the seminal fluid it has an alkaline pH that kind of protects them from that acidic shock, right? And also creates an environment for them to swim in. It also nourishes them. It has food, glucose. That also powers the mitochondrial function for them to flick their flagella and swim into the cervix and find their way into the uterus and lay in wait for the eggs when they're released. So those things they have to be known. All right. So if someone has azoospermia, they could produce seminal fluid or semen, right? But without sperm cells, then it could be obstructive. Then they can actually investigate and go directly into the testicles. We can get sperm directly from the testicles or the tubes that the epididymal tissues lining the testicles. We could also extract sperm from there. So depending on the kind of methodology that sperm is being extracted or retrieved, all right, we can say we are doing a testicular sperm aspiration, micro epididymal sperm aspiration, right, testicular sperm extraction, right. So those are, men with urological conditions whereby, right, they don't produce sperm or there's zero sperm count. We can access their sperm with a different medical technology, right? And the lady as well, we can actually help them to, produce more eggs, fertilize more eggs with their husband's sperm, and generate embryos that can potentially become babies. So that's the basis of what we do in IVF with regards to those myriads of technologies that we also assess to help people conceive safely and medically.
Wow. Wow. Thank you. Thank you. That's a very detailed explanation. Thank you.